Good afternoon. My name is Kendra White, and I'm the Senior Manager of Community Relations for UPMC for Life. We're so thrilled that you're joining us today for our Staying in Touch series, Episode 9, Resources in Your Community. The Staying in Touch series was designed with you in mind. UPMC Health Plan is here to help you stay connected and informed during this challenging time. We're happy you've taken the time out of your day to join us to hear from some of our experts in the fields of preventive medicine, mental and physical health, and other specialties about how to stay healthy, manage stress, be active, and connect with your community, all from the comfort of your home. Our program will last for about 30 to 45 minutes today, and before I introduce today's presenters, I wanted to start with a quick poll question for our audience of listeners. Today's poll question: do you feel like you know how to get in touch with resources in your community to help meet your needs? Press 1 for yes on your telephone keypad. Press 2 for no on your telephone keypad. If you're joining us via the online platform, you will see a new poll question has become available, and you will have the option to vote accordingly. So again, if you press 1 for yes or 2 for no to the question, do you feel like you know how to get in touch with resources in your community to help meet your needs? I would also like our audience to know that if at any time you would like to ask a question for one of our presenters, you can press *3 on your telephone keypad to be connected with someone from our team who will take your question and share it with us. If you are joining us via the online forum and decide to type in a question there, please provide your name and an email address or phone number so that we can get back to you, as that information is not provided automatically. If we do not get to answer your question on the live call today, we will be given a log of the questions after the call that will enable our team of professionals to follow up with your question, comment, or need accordingly. If you have questions specific to the COVID-19 virus, we ask that you visit our website, www.upmchealthplan.com/COVID-19. So again, that's *3 if you're joining via the phone today, if you have questions or comments. We also would welcome any feedback or ideas that you may have for future topics that you'd like to hear. Again, these programs were created with you in mind, so we certainly welcome that feedback. And now I'd like to introduce today's presenters. Joining me today is Dan Lavallee. Dan is the Director of Social Impact at UPMC Health Plan. In this role, he leads UPMC Health Plan's Pathways to Work program, aimed at providing workforce, training, and education opportunities to individuals on Medicaid. He also works on our partnerships to better serve those with intellectual and developmental disabilities, and leads UPMC Health Plan's LGBTQ health programming and related initiatives as well. So welcome, Dan. Also joining me is Cinda Watkins. Cinda has spent over 25 years in various roles related to human services, working in specialties including mental health counseling, staff development, crisis management, and adult protective services. The last 2.5 years of her professional career have been spent utilizing the knowledge she's acquired through her past roles to assist the United Way of Southwestern PA's 211 Contact Center as the Senior Human Services Manager. Her duties include managing the day-to-day operations at the Contact Center, as well as assisting resource navigators when they need support with complex cases to ensure individuals are directed to the most appropriate resources. And finally, my third presenter is a voice you probably recognize. She's joined me before, and this is Shannon Miller. Shannon is a program manager for our Resources for Life program and has been with UPMC Health Plan since 2016, and her background and experience is in social work and gerontology. So I am extremely confident we're going to have a great presentation today. I appreciate my presenters' time in joining me, and we look forward to hearing what you have to say. Welcome, everyone.
Thanks for having us, Kendra, and everybody on your team. This is wonderful. And for all of you who've joined, just great. I've already seen some good questions come in that we certainly will try to touch on overall as we get through the time. I think the number one thing we want you all to come away with is that we're here for you as a health plan. We're here for you as a partner with our community organizations. And Shannon and Cinda are going to talk a great deal about the resources that they have and the programs that they lead. And they are the two places that you can go no matter what to get the support that you may need, or to refer others to call and do the same. So I'm going to set the stage a little bit around what we're going to talk about today. And then we'll get into the presentation. So first, we're just going to talk a little bit about how social needs affect our health, and then a little bit about a new Center for Social Impact that we've started here at UPMC. And then I'm looking forward to Cinda's talk about the United Way's 211 resource, which is just an incredible community resource that we hope you all will take advantage of when needed. Then Shannon will take us to Resources for Life and Employee Assistance, and a little bit about the programs she leads, which are wonderful. And then also we'll spend a little bit of time on support if you're in crisis right now, or if you know somebody in crisis right now. And we'll also go over a few community resources based on some of the most pressing needs, especially during this crisis, and a few additional resources, and then hopefully some time for questions, and we'll touch on some themes. We'll try to look at it as we get through the time what you all are asking. So thank you again, and Brian, I think we're good to go to the next slide. That was right on cue. So in a nutshell, the way that we look at it here at UPMC is we know that housing, food access, community safety all have such a significant impact on our physical and mental health. And as a parent myself, I think about, how could a parent really even think about taking their child to the doctor without having proper transportation? How do those with diabetes avoid, bad health outcomes without access to healthy food in their communities? And really, how does somebody, and I think about this right now with the crisis and the nearly 1.9 million individuals in Pennsylvania alone who have filed initial jobless claims, how do you think about getting to your annual checkup when you just lost your job and you really need to think about the next steps in your life at the current moment? And those are things that we take so seriously here. And, we're, very excited to take a meaningful step forward to building out a new center and building out really a new priority level for some of these societal issues that affect us all. A lot of my own life is guided by being a parent and thinking about what I would need. And, it's very meaningful that we have this. And on to the new UPMC Center for Social Impact. So building on how some of those social needs affect our health, what we wanted to do was really develop a new kind of, resource initiative that will work to find ways to improve our social conditions for our members and the community for which we have business across the Commonwealth, especially. So some of the main areas that we think about and programs that we do have in place, and then some others that are tied to the benefits that you all have around housing, transportation, access to food, utilities. I did see a question come in around how to get help with utility bills and food assistance. One of the big things that Cinda will talk about is 211 is they're just such a great place to go for immediate need on food assistance or utility support. We will touch on the utility updates a little bit later and how that's tied to the governor's proclamation, emergency disaster proclamation, and the moratorium on utility shutoffs, which is something good to know, but again, good to go to a place to get a little bit more information. And then on here, we do not have listed, but employment is another big one that we're looking at now, especially with the current crisis. We couldn't do any of this at UPMC, whether in our new social impact initiative or really anything that we do without partnership of community-based organizations that have the trust of those that we serve. And we're just incredibly grateful to have so many organizations that do great work in all of the counties that you all live in. And then one of those is the United Way of Southwestern Pennsylvania and their 211 program. We're just incredibly excited to have them on here. They do such great work, and I'm going to turn it over to Cinda to go over a little bit of her role and the great work that she does.
Thank you so much, Dan. We really do appreciate the opportunity to join with you on this virtual phone conference with a lot of your participants to be able to really spread the word about 211 and how we can help everyone in the community. We really value the relationship that we have with UPMC, and I know that together we're both trying to do amazing work and, collectively help those in the community. So I appreciate that. I do want to say that if you do hear voices in the background, I'm actually live here at the 211 Contact Center, where we're currently assisting individuals like all of you that are on the line who might be in need of some help. So know that we're here. I want to kind of jump into to try to educate all of you on what is 211. I think we're taught from a very early age what 911 is. We know that 911 is an easy-to-remember number that we contact when we need some kind of emergency assistance from law enforcement or fire or medical help. Well, 211 is an easy-to-remember 3-digit number for when you might have any kind of human service needs. There are hundreds of thousands of social services, even just here in Pennsylvania and just in our area. And it's really hard to remember what each and every one of those agencies can do to possibly help you. So our job here at 211 is to know what all those resources are and to help you get connected with those agencies that are most likely to be able to provide you some type of assistance. As Dan mentioned earlier, the most common inquiries that I know we get here at 211 are about basic needs. And I have seen some of the questions that are coming through on the chat about many of these basic needs that we can get you connected with assistance for, including things like utilities. Are you concerned that you're behind on your utility bills? Housing. Are you having difficulty right now meeting your rental or your mortgage obligations? Food. Where are the local food pantries in your area? We're rolling into summertime here. Where are the summer food programs going to be offered? And then things like material goods, like clothing, furniture, appliances. But the thing is our database of resources goes well beyond those areas of basic needs. Things like employment assistance, support groups, benefits assistance, holiday programs, volunteer opportunities. You kind of name the area of social services or human services, and those are the resources that are included in our database. Our database to date includes over 800,000 different resources that we can help get you connected to. We're actually available here 24 hours a day, 7 days a week, 365 days a year. Unfortunately, crises don't have a calendar. You don't know when they might happen. So we want to make sure that we're available here at the 211 Contact Center all the time so that we can help to support you. It's a free service to anyone. It's anonymous. It's confidential. I do like to say that when you contact us here at 211, we will ask you some basic information. But the basic information that we ask you for is to really help us provide the most accurate referrals that we can for you. It's really up to you what you share, but the more information you're willing to share about your situation, the more accurate we're going to be able to provide agencies that are most likely to be able to assist you. So that becomes really important to us. We want to give accurate referrals. We do have multilingual navigators, and we also utilize a telephonic translation services, and it will translate for us over 150 different languages. So we do not want any type of a language to be a barrier for you to reach out to us. Again, we want to be able to assist to get you connected with resources. How do you connect to us? It's really simple. You can simply call us by dialing 211 on your phone. That will connect you via your phone with us so that we can verbally go over and talk about your situation. If you'd like to text with us, we also have that capability. All you would need to do is text your zip code to 211, and you can communicate with us via text message. You can chat with us via our website. You're going to see our 3 of the areas that we cover from this contact center in Pennsylvania. The website's listed there on the slide. If for some reason you don't see your area that you live in listed there for a website, you can actually simply get on the 211.org website and enter your zip code, and it will connect you and it will give you the information for the 211 contact center that's closest to you and services your area. Also on our website, it's important to realize that you can also self-serve. That means that you can actually search our entire database yourself if you'd like to look for resources on your own. If you would happen to need help while you're searching on our database online, you can also communicate with us via chat. You can throw a little chat message down in the bottom little box that pops up, and one of our resource navigators would be more than willing to assist you in helping to find some resources. Now, not only does 211 serve the community by helping individuals get connected to resources through the information that we collect, we are also able to educate the community as a whole about what the needs are. So what we do is we share information. Of course, it's confidential. None of an individual's specific information is shared, but we share the information about what people are contacting us about. This allows communities to help to prioritize funding and even create programs that many times fills gaps that might exist. And a perfect example of this is when the coronavirus pandemic actually first began, there was a real disconnect in food. Food was many times available in the community, but many times there were vulnerable individuals that were sheltering in their homes and unable to leave. And we were getting a lot of calls from individuals that were saying, hey, I'm in my home. I know that there's food out there, but I'm not able to get out to get it. Is there any way to bring food to me? So the United Way and 211, through reaching out to community partners, we were able to help to try to fill that gap and help to create emergency food delivery programs so that we could get that food out to those that really needed it and were in need. We also set ourselves apart from traditional information and referral services in that we offer follow-up to our contacts. If a caller agrees to that service, we'll call them back at a specified time to ensure that they were able to get assistance. Find out if they hit any barriers in that process. We can help problem solve and possibly come up with alternative resources to assist them. And oftentimes it's a really welcome service so the callers don't feel like they're left out on their own during what is more than likely already a very stressful time in their lives. So we want to be a support system to them as well. So no matter if you're out of work for the first time and struggling to pay your bills, or if you've been struggling for years to try to stabilize your situation, we really want people to know that anyone and everyone can contact us here at 211, and we'll help to connect you to resources that can really help make a difference in your situation. You know, we're only 3 digits away. Hopefully it's an easy way for people to remember. This is the way that you can very easily get connected with resources. So hopefully that was an informative overview of what 211 can offer to you and how we can help you possibly in your situation, maybe yourself, a family member, a friend, a neighbor. Make sure that you share this information so that we can get the word out and we can get individuals connected to those resources that are out in the community. So
thank you, Cinda. That was very, it's a very valuable resource we have in our community. It really blows my mind. It's so simple and so many connections can be made that way.
It is.
We are getting a lot of great questions coming in as well. And I want to remind our listeners, if you have a question, you can press *3 on your telephone keypad to be connected with someone that will take your question live on the phone. But, you know, it's just seeing some of the questions that are coming in. really reminds me that there's so many more resources in addition to healthcare resources that people need connections for. In fact, our first poll, only 38% said they felt comfortable that they could connect with resources in the community. 62% said no. So we really appreciate you promoting the 211 today. It's definitely a resource we will remember and continue to promote in the future.
Thank you. Thank you for the opportunity.
Sure. And I think Shannon Miller is up next to talk about Resources for Life.
Hey, thanks so much, Kendra. Hi, everyone. As Kendra mentioned, I'm Shannon, and today I'd like to talk with you about some of the programs that are available to you within the health plan. UPMC Health Plan offers resources for assistance with your everyday needs through programs such as Resources for Life and the Life Solutions Employee Assistance Program. These programs are available to many UPMC Health Plan members and offer the following: personalized searches. A few examples of personalized searches that can be offered include things like child care, elder care, medication cost assistance, searches for transportation programs in your area, and much more. A personalized search is conducted after going over a few questions with you in order to be able to provide the best possible resources that may be able to assist you. Telephonic counseling is also available for you, as well as for caregivers, to assist with a variety of needs for things, such as family and relationship concerns, anxiety, depression, plus more. Counseling can also assist with resources for communicating effectively, making tough decisions, setting goals, and solving problems. In addition, financial and legal consultations are also available to help with things such as estate law planning or help with budgeting. So as you can see, there are a variety of resources available to you, and we encourage you to take advantage of these resources. So we'll now go back to Dan, who will go over some additional resources available.
Thanks, Shannon, very much, and thank you, Cinda. You both have just provided such incredible support to our community and to our members, and it's great to have you. I mean, I think the best thing, and as we go, we're going to go through a couple other resources just to keep in mind. But so much of this, if you have any question on anything that they both said or that we talked through, is just very easy to call 211 or to call the number on your insurance card and get in touch with us, and we'll be able to get you to the right place. That's just the number one thing we want you all to remember. So as we continue on, and we'll take some of the questions at the end, as I'm seeing a lot of common themes in a few of the questions, which will be great to touch on. But we did want to talk about, if you're in a crisis right now, or or have a family member in a crisis right now, we wanted to provide some information about where you can go immediately for support. And for those of you on the phone, I'm going to read a couple of these numbers off and what the hotlines are, and then we'll also have these available at the end of the presentation to share with you all. The National Suicide Prevention Lifeline, 1-800-273-8255. The Crisis Text Line, text PA to 741-741. The Veteran Crisis Line, 1-800-273-8255, and press 1. And these are only a few other resource and crisis lines out there, but people are there to support you and to be with you. So we wanted to provide that to you. So now as we head to other community resources that we have out in the community, we did want to start right now with unemployment. Of course, the jobless numbers are staggering, but there are supports here in Pennsylvania that are here for you. So if you have just recently lost a job and would like to look into unemployment compensation, please search for the Pennsylvania Office of Unemployment Compensation. Their URL, we'll read a couple of these, not all of them, www.uc.pa.gov. Now, they are doing as great of a job as they possibly can to process as many claims and talk to as many individuals from the statewide level, and we encourage you to reach out. Another resource that is an important partner for us here at UPMC and for many others across Pennsylvania is what's called the Pennsylvania Career Link. And that is kind of the one-stop shop for individuals that are looking for work, looking to find maybe a jobs that are ready in the area that they live in, soft skill development, connections to different training programs. We have a number of training programs at UPMC, as we have tens of thousands of employees across the Commonwealth, especially, that we would love to help people learn about and get into that could fill jobs that are needed. So the Pennsylvania Career Link is the best place to go in your community. There are other employment agencies in Western Pennsylvania and many others. We have Goodwill. In the central part of the state, there are also Goodwills, an organization named Tech Centro, Manchester Bidwell, other organizations in your communities, but the easiest place to go to really understand is the Pennsylvania Career Link. It can be found by searching online. And also, any of these employment resources, if you get in touch with Cinda and her team, she can provide you with the same ones. We also have a new program that is a little bit more specific to our members that are on our Medicaid plan called Pathways to Work, where we are looking to connect our members to employment resources and training in different areas where we operate. So please, the number one thing to remember, call us. We'll be able to help you get connected to the resources. Lastly, before we move on to the next slide, and some of this was in some of the questions that the great questions that were being asked, we want to make sure that you all know that there's a place to go and resources for other human service benefits, whether it's to help you get signed up for the Child Care Works program if you have a child that is of age, whether it's for cash assistance, which is temporary assistance for needy families, the Supplemental Nutrition Assistance Program. I see a number of questions being asked about food assistance. The best place to go is compass.state.pa.us. That is the organization that will really help you get access to benefits in a fast and easy manner to apply for these benefits. It's a single access point to a number of the ones I just mentioned, also others around low-income home energy assistance program, or known as LIHEAP, and others around long-term living as well. It's just an incredible resource to have, and that's one that we wanted to make sure that you all know. And the reason that that's such a good place to go to is because there are a variety of different eligibility criteria, financial eligibility criteria for some of the different programs. So it can be a little confusing, but the Compass team will be able to help you understand what you might be eligible for, as it is a little bit different. So I did see a few questions about that, so that's a great place to go to have somebody to support you, to walk you through some of the eligibility. All right, as we move on to additional community resources, we wanted to touch a little bit on housing. And of course, again, if you have an immediate housing need, best place will be to get to the 211 folks, and then also to some of the housing authorities within the counties that you live in. But we wanted to provide a couple of reminders of what's happened as of late within the crisis. So as you might be aware, there were multiple different legislative packages that were passed out of the United States Congress, most recently the CARES Act, which provided a temporary moratorium on evictions. That's important for anybody to keep in mind who might be heading into that and has a need there. Keep that in mind. And then on that note around the halting of evictions, also most utility terminations have been stopped. Now, the governor a couple months ago did provide a declaration, a disaster declaration, and while that remains in place, there will also be a moratorium on utility shutoffs that's run out of the Public Utility Commission. So that could be electricity, natural gas, telecommunications, water. So that's something to just keep in mind, is that this is still in place while the disaster is still in place. And if you have any questions, the best thing would be to call us, call the 211 team, and they'll be able to connect you to the resource there in your county to have some of those discussions. But just very, very important to keep in mind. I'm not going to touch too much on food. Really, because the best place to go is to get to our 211 team in whatever county that you live in to understand where the resource is. The Pennsylvania Nutrition Education Network is an incredible resource to see where food distributions are within the county that you have. You know, Allegheny County has a great food distribution map on that website, and that would be PANEN.org/COVID-19-food-resources. Great place to go to be able to understand and see where that distribution is for you all to get the assistance that you may need. On voting, which is clearly an important thing, and if you are interested and able to vote in this election, we wanted to remind you there's a great resource to go to, www.votespa.com, and they'll be able to walk you through some of the different processes with voting this year, and it's just a great resource to go to. I think lastly, before one thing I did want to mention back on food, there's also a program that the Department of Education here is running to help families understand where the distribution centers will be for meals for children who are getting them through the schools. Just another incredible resource to go. Again, call 211 would be great, but then there's also some information online if you search the Department of Education and meal distributions for children. So as we move on to our last slide on community resources before we get to the end of the program, we operate everywhere, and we feel like we live in Mr. Rogers' neighborhood, even if it's Pittsburgh and beyond, of course. And of course, he told us to find the helpers always. And I know that's what we all want to do for each other. And that's why, I love working at the place that we do and then living and working in the state that we do. So just to give you a few tidbits of information on what you can do in this time to find some volunteer opportunities. I did see a couple great questions around how to volunteer and how to find meaningful opportunities. We wanted to provide you with one website. This is not Pittsburgh-centric. It just has Pittsburgh in the name, www.pittsburghcares.com, which is an incredible place to go for local resources, but they also have state and national and other opportunities around making masks. I know we're trying to make a few masks here. It's not gone too well. My daughter wanted to make a few. We're struggling. We might be able to. But then also there's resources to find out where you can donate blood, which is incredibly important to us, of course, working at where we do. And then, one of the other things in my life, my grandmother was one of the most important people to me, and it guided my life. And I wish she was here every day still, of course. But just something to remind, just check in on your family and your elders in the ways that we're able to now. Social isolation is a real thing, and not that we all need a reminder for it. I was just thinking about it my own self in our life. So I know we covered quite a bit here. I'm going to kick it back to Kendra here. There's some questions we can go through, of course, here, and some reminders to give you. But the number one takeaway: we're here for you. Our community partners like 211 are here for you, and we'll get through this together. So Kendra, back to you.
Absolutely. Thank you, Dan, and thank you, Shannon and Cinda as well. I think we've definitely overloaded everyone with so many websites and resources, so we're going to recap some of those. But before I do that and we address some questions, I have a second poll question that I would like to ask our audience. Do you feel that you have gained information and knowledge about available resources if and when you might need assistance? Press 1 for yes, press 2 for no. After today's presentation, do you feel that you have gained information and knowledge about available resources if and when you might need assistance? 1 for yes and 2 for no. And as I said, a little bit earlier in the beginning, 62% of you said no. So I'm very anxious to see how many of you had a lot of information that we shared today. I do want to mention our website where you can find all of our previous Staying in Touch series. The slides and the recordings are housed here. And that website is www.upmchealthplan.com/in-touch. And again, you can find all of our previous talks and the slides there. So after a few days, today's will be up there. So you'll be able to see these slides and be able to have all these websites available at your fingertips. Any information about COVID-19, we do have a website for that if you're looking for more information. And that's upmchealthplan.com/COVID-19. So there are a few questions and a couple that I wanted to address as far as the 211. Someone had asked if you have to be a member of UPMC for life. That is not, you do not have to be a member to use 211. 211 is available to anyone in the community. So you can, there were certain ways you can get in touch with them, a text message, online, or by dialing 211 on your keypad of your phone. And Cinda, I had a few comments on here that, it's been busy or, they're trying to get in touch. Do you want to address that or give some suggestions and maybe remind people again how they can get through?
Sure, absolutely. And unfortunately, there are a lot of individuals reaching out to us that are in need of assistance right now, especially. So our lines have been a little bit busy, but I want to encourage people, you're going to be provided an option when you get through to us, and you follow some prompts that are going to get you to the right resource navigators depending on what your need is. If the wait ends up being a little bit long, you're going to be prompted to leave a call back. And what a callback means is that your place will remain kind of in line. You'll remain in that line for service. And when your call would have come up, our resource navigators will receive your message and will call you back. So please, if you're pressed on time and you're not able to wait for a resource navigator, please leave us a call back and we'll get back to you. That's definitely an option. And of course, you have alternate options as well, including that text and chat option. I did see a question about somebody having difficulty with their phone being able to dial 211. Unfortunately, there are some issues, especially if you're in a building that has outgoing lines and has extensions and things like that to it, especially, and depending on where you're located geographically, sometimes the phone lines don't necessarily like the number 211. So if you're looking for an actual full-digit phone number to call 211, all you would need to do is get on 211.org's website, enter your zip code, and it's going to give you a full, what we call them, backdoor or alternative numbers to dialing the 211 so that you can always get in touch with us. And, I apologize. Sometimes it could be frustrating if you try punching in that 211 and you just initially get a busy signal or something like that. That's telling you that that phone call is not going through. So please reach out to us via one of those alternative numbers so that you can get in touch with us.
Great. Thank you, Cinda, for addressing that. Dan, was there anything that you wanted to comment on that you see in here? There's so many questions today. I'm very, very pleased at the response. We will be getting back to you, so do, appreciate your patience if we don't get to your question today. There are really great questions. Sorry, Dan, go ahead.
Yeah, no problem. That's an absolutely great point. There were a few things on here we did just want to remind you all of. We do have a UPMC 24/7 nurse line, which if you do have questions very much in tune with your health and anything related to the current COVID and the crisis right now in your own health, please remember that we have that at any time, and that is 1-866-918-1591. Another thing we just did want to touch on, I saw a few questions in here related to specific support that we have for members with transgender experience, and for a reminder that we wanted to let you all know that we have a specific team of individuals within the health plan that are here to serve our transgender members. So please call. You can call the number on the back of your card, and you will be directed to a team that has experience in serving the community and will be ready to answer specific questions. So we just wanted to remind that. I saw a few questions in there. Another one, I did see one kind of around checking the status of your property tax rent and rebate program application. So that is clearly an important one here, and one that is a statewide program. And the number there to call is 1-888-222-9190. And to check the status of your application there's also resources through the Compass resource that we were able to provide there as well. So that's a few things to just keep in mind. Kendra, I think a lot of the other questions, 2-on-1 great questions that I think can be answered, as we get there. I think that should be it about now.
Yeah, I think everyone that we're going to get back in touch with you. So if you connected with someone to ask a question, you will hear back from us. We've been, taking precedent to try to make sure everyone's contacted within the next 24 to 48 hours. And there were a lot of great questions and needs that I see coming through. So we're definitely going to take, great care in making sure everyone's reached back out to address their needs. I want to brag a minute about the poll. Looks like 94% now went to yes. they feel confident that they can connect with resources in the community. And then again, we've said it multiple times today, we are here for you. Our communities are strong, and they will continue to get stronger as we grow through this pandemic together and learn and just lean on each other. So it's very important, and we're so thrilled that you joined us today. It was a lot of information, great resources that are out there, and we hope that you can take advantage of them and utilize them to help your family situations as well. Next week's episode, Tuesday at noon, will be about National Senior Health and Fitness Day. This is a day that we have every year. We promote physical activity and connecting to, resources and other activities to keep you strong mentally, physically, etc. And Jen Marchowski will be with us from Silver Sneakers, and she'll walk through some different exercises that you can do from the comfort of your home. You'll also get information about Silver Sneakers at-home fitness kits, live fitness classes, and some new online programs that can help you stay active. So we are, unfortunately not able to do our signature event in person this year, but we are definitely, tabling it, and we're going to keep evaluating the situation until we can all be together again, promoting our physical activity and keeping our members active and engaged. So we look forward to having you join us next week. And with that being said, I think we can wrap it up. Shannon or Cinda, Dan, do you have any final comments before we close today?
Well, I think just thank you for your time, and we're here, always. So please don't hesitate to reach out.
Thank you. Thank you for the opportunity as well. And please remember 211 and contact us. That's why we're here.
Great.
Thanks so much, everyone. Thank you.
Have a great afternoon, and we will talk with you again next week. Thank you.